And thanks for tuning in to WTVI's medical broadcast, Healthwise. I'm your host, Joey Popp. We have an interesting hour ahead, and as always, welcome your input. Children may have undetected visual problems that interfere with their ability to learn. Early detection can save years of struggling. So, what are the signs and symptoms that may be overlooked? Great questions for our medical expert, Gina Beasley, of All Ages Vision Care. She's about to address the critical link between vision and learning, and how vision therapy may provide a solution to these and other important issues. Welcome, Dr. Beasley.
Thank you, Joey. It's a pleasure to be here.
And you're located in Charlotte?
Yes, down on Highway 51 area, South Charlotte.
And this is your first appearance on Healthwise.
Yes, it is. I'm very excited to be here.
You know, and we're excited to have you as a new guest, but we're also excited that you bring a topic that touches our youth.
Yes. Vision is one of the main ways that we bring in information when we're learning at school. And I wanted to educate our public on how vision is such a critical link to the learning process. And when things are working well, vision leads. And when vision is not working well, it interferes with the performance levels of kids.
You know, is it safe to say that we take our senses for granted?
If you don't have any problems per se, we do. If you have problems, then we don't always necessarily know how to describe them. And they show up as different symptoms that we'll go over today,
right,
that are easily to see and observe.
Right. And if you don't know you have a problem, probably even more of a reason why, well, heck, you know, I see just fine, I hear just fine. What's the issue here? Well, that is what this whole hour is about, is to help detect, to see if there is an issue, at least with one sense, and we're talking about vision and how that's a critical link between learning and the visual impairment or the visual health of the eye, especially in young people. So we expect to have a fascinating hour, but first, I must say, I'm wearing a red tie, and it has a touch of pink in it, if you'll see.
Yes, I see
and
that.
that's in honor of Kay Yao and also to you.
Well, thank you very much.
I have to say, Dr. Beasley is a member of the North Carolina Sports Hall of Fame, where she played basketball at NC State for Coach Kay Yao. What an honor that is for you to be a member of the Hall and for you to have played for Coach Yao. What was that like?
That was an awesome experience. We were in the top 10 every year that I played. I played from 1976 through 1980, and it was in the pioneering years when Coach Yao was just starting at State. And we just had an awesome time playing all different schools, both in the state of North Carolina and also internationally. I played during the summers, so I was on some pre-Olympic development teams and got to play against the Russians and the Bulgarians and the Chinese. It was just a great opportunity in that time of my life.
And when were you inducted in the North Carolina Sports Hall of Fame?
In 2007.
Wow.
And Coach Yao, who was still going through her chemotherapy at that time, was able to make it to that, so that it was a very special occasion for me.
Oh, I know it was. And still, you hear the name Coach Kay Yao, and I wore the pink because she was such a supporter and such an advocate of speaking out against breast cancer, right?
Yes, yes. She was very, very open about her battle with that, and she didn't let it slow her down, though. She was very passionate about early detection and showing that it didn't do any good to sit around and feel sorry for yourself, and just to go on with your life and live it as fully as you can.
Now, what did that experience have to do with what you do today?
I think playing basketball and playing at that level, you learn to be competitive and you learn to push yourself past things that may seem impossible at the time. And when we work with children with visual issues, I use that mentality of focus and don't let anything take you off your focus and take you off your game. Bring your A game every day.
Excellent. Join the conversation as always. We welcome you to call us. The number's on the screen. And I have the PDA on set once again. You can email me, jpopp@wtvi.org. Let's go to this first slide if we can. Dr. Beasley has brought us lots of good visuals. And I just have to ask, when you have 20/20 eyesight, and if the eyes are healthy, does that mean that your vision is normal?
Well, Joey, 2020 is one of the areas of the visual skills and the visual system that we're looking at. And most commonly, people are aware of eyesight, and the normal eyesight measurement is called 20/20 vision. If you need correction for that 20/20 vision, you may be either nearsighted, farsighted, or have some distortion at both near and far, and that's usually called astigmatism. There's another term that's called anisometropia, which is when you have perhaps one eye is farsighted and one eye is nearsighted.
So what other visual skills are needed for learning besides 20/20 eyesight?
Well, we have the visual skills or the visual efficiency skills, and we have visual perceptual skills, and we have visual motor skills or eye-hand coordination. And these are in conjunction with the normal ability to see clearly, which is the 20/20. And eye health, obviously, if the actual eyeball is healthy, that's certainly a very necessary component.
So if I'm a parent and I'm watching this show, with that last slide, what do I need to do to make sure that my 6-month-old or my 2-year-old has no visual impairment?
The best advice I can give you is be a good observer and watch for signs of tilting or turning the head or closing an eye when you're trying to see. That's a very common sign that one of the visual skills of eye teaming or binocularity is not developing properly. Another common thing with learning to read in school-aged children is the inability to learn easily letters and numbers when they're just starting kindergarten or first grade. And they also show difficulties with getting those letters on paper with using a pencil. They may have a lot of reversals. There's a lot of angst in actually sitting down to look at a book, and if they're not really avid color, they don't like to color, which means there may be some kind of near point stress in the visual system that would make doing things that should be rather easy
and
not
fun.
so easy. Yeah.
So there may be frustration there. So if I'm the parent, don't look at it as, well, Johnny's not interested. Johnny may not be interested because he has an impairment.
Right.
Interesting.
Or perhaps a visual skill that's not developed to the level that it needs to be for that to be easy or fun.
All right. Now, the next few slides address visual symptoms. So let's go ahead and go right next to the next slide. What are the visual symptoms and behaviors associated with vision problems that interfere with learning? And the slides will be coming back up in just a few seconds.
Okay.
Until they do, let's just go ahead and address visual problems.
Okay. Some of the primary problems that present to our office are eye teaming problems. One of the most common ones is an eye tracking problem, where the child may be experiencing losing their place when they read. They may skip words. They may skip whole lines when they're reading a book. They typically have trouble catching a ball, so their eye-hand coordination is off because of the tracking is not as developed as it needs to be. You can also have double vision or squinting or, again, a lot of movement when you're trying to sit still, just trying to find a comfortable spot to do your work.
Motor skills?
And getting the information back down on paper, we have trouble finding the lines or hitting the lines when we're writing, or we may not space appropriately. And a lot of times the posture is a good indicator. If a child is having visual stress, one of the first things they do is get really, really close to
I've seen that.
to the surface, because when they get closer, it magnifies and makes it bigger. But it also puts a lot of undue stress on the eyes to team and point at the same direction. The closer I am, the more stress is on that system.
All right. So if you work with young people, how early should my child come see a specialist like you?
Well, the American Optometric Association suggests that children are seen before age 1, 6 months to 1 year of age. There's actually a nationwide program that's called Infant SEE, and that is a program you can look up on the internet and find a doctor in your local area.
Do you know the website?
It's infantsee.org.
Okay, so it'd be INFANTSEE, correct? .org. We'll try to get that typed up and put on the screen for you. What am I going to discover when I go to this website?
you can see the normal milestones, the developmental milestones that should be present at certain ages, between 6 months to 12 months to 18 months, all the way up to 5 years of age. The visual system changes the most between 6 months and 5 years of age of any time in life. So
it does.
It's a very exciting opportunity to intervene when things aren't being developed appropriately, and to help educate parents to know what to look for.
Okay, so important before the age of 5. Be sure and hear that once again, that it's between what, age 1 to 5?
Yes, the normal is between 6 to 12 months. The Infant C program is actually a free comprehensive eye exam that's offered by optometrists that provide that service as a complimentary, service to your child. And the other times that are important are at age 3 and at age 5 before starting school.
All right, thank you so much. We have our slides back, so let's go back to visual symptoms and just tell us what we're looking at here. Some of those letters may be too small for some of our viewers, so if you can just touch on it.
Sure. The visual efficiency skills are called tracking, which is ocular motor, or eye teaming, which is called binocular vision, and the near focusing or accommodative system. And some of the most common symptoms are short attention span. So a lot of these things can be mislabeled as attention deficit. It's a very common association. There's some double vision perhaps. With laterality, directionality, you can have some trouble learning left and right, and kids tend to reverse letters and words. And with visual form perception, they may have difficulty recognizing shapes and size differences. With visual memory, that's involved with spelling and also with reading comprehension and having a inability to picture what they're seeing or hearing.
And sloppy handwriting's one of them?
Sloppy handwriting is a visual motor integration, the eye-hand coordination, where they know how to spell maybe, but they can't get it down on paper. They can't stay within the lines. They can't copy from the board. And when they want to give you an answer, they'd rather tell it to you orally than to put it down in writing.
These are all symptoms to keep an eye out for, parents and grandparents watching.
And some of the physical signs are frequent headaches. That's certainly a red flag to get your vision checked. Blurred vision and avoidance of close work, poor depth perception, difficulty following a moving target, again, double vision, dizziness or motion sickness is commonly a problem that we see, and certainly if you see an eye turning in or out or up or down, that certainly would be a sign that something's not developing properly. If you've gone to see any of the movies lately, the three-dimensional movies where you wear those special glasses, a lot of times people will have symptoms of dizziness or they have trouble with all that motion. I don't know if you've seen the movie Avatar.
Yes, I know what you're talking about.
The three-dimensional effect of that. If you've got binocular eye teaming problems, you may not even see the depth on that if you've got one eye that doesn't work with the other one.
So if you are in the theater and you don't give it one of these as if you want to go out and touch it, that's a symptom that maybe your eyes are not looking at it like they should through these glasses.
Right.
Interesting. All right. So you've also brought us some props here on set.
Yes.
Is it a nice time to maybe go to one of these while the slides are being reshuffled?
This is a efficient reading skill. A couple of sentences here at the top, which it says, Paul likes to take his purple toy truck to the playground. A child with eye tracking problems may mistake these words as Paul likes Esto take his, it doesn't make any sense. So on the eye tracking, the next one down.
Yeah, Jason, if you'll just tilt down a little bit. There we go, eye tracking.
This one is where the words kind of get stuck together and they jump into each other. And
so here's an example, playground, right?
Yeah, and you're reading it like this sitting next to the child, and they're saying something that's not even there on the paper.
I see. So here's an example, truck to the playground. And this is how it's interpreted down here, truck to thee. There's no space between the to and the thee.
Right.
Playground, So that's how they're writing that out?
No, that's how they're saying it as they're reading it. because that's the way they see it. That's the way their eyes are bringing the information to their...
So how would they pronounce these words then? Instead of to thee, they would say...
They may say to... They may be going to, and not just doing a phonetic equivalent of the word.
Interesting.
Yes.
So instead of thinking, okay, isn't this cute? They're talking baby talk.
Or they may have a reading problem.
They're having a reading problem
You see?
because perhaps a possible visual impairment.
A lot of times this is perceived perhaps inappropriately as a reading problem, but if you have these words in a list, they may be able to say all those words easily enough. They may be able to decode the words, but when they have to go and track it across the line, that's when the trouble starts.
All right, so to make sure we understand, if I'm at home watching this exercise right now, these examples you've just given me,
Yes.
what can a parent or a grandparent do with their child or grandchild with this exercise?
One of the things that helps this not happen, that helps the eye tracking not to be a problem, is to actually let the child take their finger and put it under each word. That will help their eyes know where to look.
And to make sure they pronounce the words correctly.
Yes.
So
Yes.
read out loud.
Yes.
Make sure the child reads out loud. And if you detect, parent or grandparent, that they're reading like the way these words are spelled down here, it's time to see an optometrist.
Yes. Yes.
How about an ophthalmologist?
Well, an ophthalmologist is trained specifically in eye disease and surgery. So this is more of a functional issue, and ophthalmology is not as well trained, I don't think, in functional issues as an optometrist would be that has special training in this.
So if I'm a child, I'm going to benefit going to an optometrist. Is that what you're saying?
Yes. Yes. One that has specialty training in this particular area.
How do I know that? Do all doctors do this testing?
No, they do not. Sometimes when you have a routine eye exam, for example, you have the ability to check for eye health and your eyesight, which is the 20/20, get your contacts or your glasses. And if they see that there's signs of a tracking problem or a eye teaming problem, they may then choose to refer to a specialist that would spend the time to do this specialized testing, because it is time intensive. It takes about an hour to do most of these tests that we need to do to tell exactly what's going on, to know how to treat it.
But so well worth it if you feel that there is a problem. Okay, let's just go ahead and collapse this. And did you have something here? Now, I have to tell you, when I looked at this in the green room, it's double vision, right? I can't look at that. That hurts my eyes. Is that normal? Is it supposed to hurt my eyes?
It may give
Jason,
you,
zero in on this.
It may
Let's
give
see.
you a sense of uneasiness of,
Can you see that, ladies and gentlemen? It's double vision.
That's when you have some confusion and misalignment between the eyes, but this is not as severe as one eye is really drifted way far out where you'd be able to notice it. But certainly it's enough to put some visual noise or chatter into the system that would make normal reading not so much fun.
But how do I know my child is reading with this double vision? Through an eye exam?
A lot of times the behavior you're looking for is closing your eye or tilting or turning so
I
that you're
see.
blocking the vision out of one eye.
And if they do that, does that help?
Yes, it'll get rid of the double images. Because you have one image coming from both eyes, and if they're not aligned in the same spot, then this will be somewhat what it looks like. And you notice the larger the print, the easier it is to tell what the words are saying. The smaller the print, it's more difficult. You have to spend a lot more energy to get the information from what this is saying if you have this type of a disruption in the visual pathway.
That makes sense. Wow.
So first and second graders can read, because there's a lot of space between the words and the words are bigger, the font's bigger. When you get into third grade chapter books, the first thing the child's going to be doing is going, how many pages do I have to do before I'm done? That's another sign that
They're just
this
not
is-
comfortable.
Yes.
They realize that there's something wrong. Is there a sense of embarrassment that they don't want the teacher and perhaps their classmates know that, hey, look, I'm not getting this?
They typically don't like to read or be called out loud to read out loud, or by the time they've had a whole day of school, the words are jumping around and they don't want to get to homework, so they may hold it together for school and then be a bear when it gets to homework time.
Well, this is very enlightening. Let's go ahead and collapse this one too. You're welcome to join this conversation at 704-371-8895, or you can email me, jpopp, P-O-P-P, at WTVI.org. Dr. Gina Beasley is here with us from All Ages Vision Care here in Charlotte. And as soon as the visuals are back up, Jerry, just let me know, and we'll go back to the next set of visuals, okay? We're still going to get to those in just a few seconds. So when learning is difficult and it can be challenging for that parent, is that when you must pick up the phone and decide, okay, there's something wrong? Do I go to my family physician? Perhaps he or she can refer me, not realizing perhaps it's a visual impairment.
Right. A lot of times the pediatrician will do an eyesight check to see if the child is able to see normally. And also there's an eyesight check at the school. So that may have already been ruled out, and it may be that, well, vision must be fine because we're seeing fine. But a lot of the referrals are actually coming from the support staff, the reading specialists, the people that are in tune with these types of problems. Could be a child psychologist that's doing some testing to see how the child learns. Sometimes it's the occupational therapist that's working with the child on their handwriting that determined that there may be a visual problem that needs to be ruled out.
Wow. All right. So if not all doctors actually check for this, how do I know I'm going to the right doctor once I go to a specialist like yourself? What should I, the grandparent or the parent, be asking the specialist?
Well, you want to find out what type of testing will be done. Is it a functional type of testing, which includes testing for eye tracking, eye teaming, and eye focusing skills, specifically at a near distance, because we can't assume because a child's under 40 that they're using their visual system appropriately for near.
Are any of these tests, do they hurt, or
No.
is the child going to experience some discomfort?
No, I can actually show you one of the tests that we use for eye tracking.
Okay.
And it's using a set of goggles like these, which have infrared sensors in the background. There's no lenses or anything, so a child would actually put this on and look through it and read a passage, which these goggles are actually hooked up to a computer, which would give us a readout.
If you'll just hold those straight up and the camera will find it in just a second.
Yes.
So if that's infrared, because of that technology, it's going to show you, the doctor, if the patient is seeing certain letters. Is that it?
Well, I've got a handout of the recording that this will do for us. And
So
I'd
it
like
actually
to
shows you on paper.
share
Can
with
you
you.
show us what it
Sure.
looks like?
This is
I'll hold this one if you want to hold the other one.
okay.
And tell us if we have a glare on it. I'll try to bring this down. Maybe we can get rid of that banner there so we can just see exactly what we have. All right, you
Okay,
have some
great,
graph here,
great.
right?
This one, as you can see, the natural zigzag and that looks like a stair-step formation here on this one here.
It's the red, right, Dr. Beasley?
The
You see
red-
that, ladies and gentlemen?
Yes. The red is the left eye and the blue is the right eye, just as if you were looking. And the
If you
words,
can see that, red and blue. Okay, go ahead.
and there's words on there that show you the type of text that was read and what kind of words were read at the time
Right.
that this was being recorded on this side here.
Okay.
Now, this is a normal one, which means the eyes are tracking and teaming normally.
Okay.
Now, on this one, you can
Look at the
see
difference.
this is a third grader also, and you can see how they do not cross in the middle to make stair steps. They make more of an in and out movement between.
Can you see that at home? See the difference? So that tells you, the specialist, that there's a problem.
This tells me that their eye teaming and tracking has not developed to the level that they should be able to read chapter books easily.
All right, so if I go and take my child to a specialist, I need to ask, do you do a sophisticated test like eye tracking? Is that what I need to be asking?
Yes, yes. And also, if there are learning to read problems, then you want to know if there are visual information processing tests that are available to give me an age equivalent or a developmental age of what this child is able to do, and is that appropriate with what level they're expected to do at school?
All right, let's go back to the slides. And we was talking about doctors and if everyone does do this, but let's first address the vision problems. I don't know if we looked at this slide. More vision problems and some of the symptoms.
Yes, these are just a conglomeration of a lot of the most common things that we see. Poor reading comprehension, the copying, again, is a problem, either due to poor handwriting or just poor ability to focus and reorganize visual information from a far away to a near place in space. They have difficulty changing the focus back and forth, and they may have letter and number reversals.
All right, so routine eye exam or developmental vision exam.
We've talked about routine eye exams, checking for the eyesight and the eye health, and corrective lenses to be prescribed if needed. A developmental vision exam has a thorough general health and developmental patient history. Vision has normal sequential developmental milestones from age 0 through 12 years of age. So we're looking at different developmental milestones that may have been missed or may have been late that would give us some insight into why these visual skills are not developing properly. And then the testing is focused on specific tests and performance-based tests in the function of eye tracking and eye teaming, eye movement, and also visual processing skills of learning to read, which include left and right. We have some slides on the left and right and the laterality and those kinds of things. But those all tested, and these tests take anywhere from an hour to 2 hours to do. So
Is the young person going to be patient in order to get all these tests done?
the first thing I look for when I'm doing a test on a young child is I have a conversation with them to see, and I look at the history to see developmentally, what age do I need to talk to this person? A developmental doctor knows the different developmental stages, and they can tell at what level of performance should I expect from this person. So I may use my 5-year-old exam on a 10-year-old chronological age because it's more appropriate for their developmental level.
All right, let's head up to the Unifor. We have Jennifer with us from Hickory. Hi, Jennifer. Welcome to the show.
Hi, how are you?
I'm well. Hope you are.
I'm great.
What's your question for Dr. Gina Beasley?
Well, I have a 7-year-old daughter who has an eye turn that she mentioned earlier. She's very clumsy, can't ride a bike, constantly running into things. We're seeing a ophthalmologist, and she's doing a lot of patching, a lot of hours a day. And I've never heard of this before, and I'm just wondering if it may be something that a doctor like this could help me with.
All right, maybe something that's being overlooked right now. Dr. Beasley, can you address Jennifer?
I can. Thank you, Jennifer, for the call. The things you're experiencing with your child are very commonly associated with a strabismus or an eye turn, as you call it. And certainly the therapy that we would do for that particular type of situation would be to first analyze and get a developmental checkup so we could tell at what age level the gross motor skills are developed and the bilateral integration of the body, which is easily determined through a few tests. We could tell what kind of therapy would be best, whether it might be some part-time occlusion, it might be some general movement skills, it might be some eye-hand coordination things that would allow the child to develop the vision in the eye that's not developing properly.
Does this help, Jennifer?
Yes, it does.